Our spine.
Yes, sir.
Is that right? So how would you describe Scours test? Remember? Someone raised their hand, and how would you describe Scours test?
It's almost like kind of grinding the head of the femur into the acetabular.
Pretty scientific test. That's really what you're doing, right? You're flexing. Yeah.
It's similar to the Thomas test, but instead you are like applying pressure. You are applying overpressure.
That's right. So Thomas test meaning we're going to flex up. But this time, so did you mean the position-wise?
Yes.
Yeah, so the flexion-wise, now I would come up over top of this. You're looking, you know, wouldn't be in the patient with acute hip pain. I mean, this is already positive. You're hunting for stuff in this case. And you guys using the lumbar spine, as I recall, to clear the hip. So you're really looking to load the hip and clear it. So in this case, I'd come up over top of this, I'd flex them up, just start rotating. Scour, clockwise and counterclockwise. How you doing with that? Healthy hip joint should be able to tolerate that. All right, so once again, flexion, come up over top, put your body weight over top, flex them up, adduct, abduct. If you want to go the opposite way, you can do that. Be real, real gentle with this though. Some of you are going to have pain with that. That's scour. Easy enough?
Easy enough.
The next test is sign of the buttock. Sign of the buttock. Another test that's extremely scientific. Not really. If you do the straight leg raise test, did you guys learn this for the lumbar spine? So straight leg raise. Do a straight leg raise. Human Wooden's limited right about there. Okay, I don't know if it's because of his hamstrings being tight or his hip blocking this motion. So what can I do? He stops there. Is it due to his hamstring or a problem in his hip? We don't know. So if I take slack off his hamstring, should I be able to further flex his hip?
Yes.
It's not his hip. You could put your name on this if you want. It needs a name. The sign of the buttock. Your book doesn't say it, but where else this is really described, patients who have a positive sign of the buttock are patients who sometimes have some type of cancer, tumor, or infection in the hip. You don't have a positive sign of the buttock. Positive sign of the buttock would be I straight leg raise up, I get to here, I bend the knee, and I can't go any further than that. That's a concern. It doesn't really say it in your book, but this test has sinister pathology written all over if it's positive. You can't flex the hip beyond this point, that's a problem. Okay? But we just talked about it in terms of differentiating those posterior structures, hamstring, sciatic nerve, from the hip. Make sense? Easy. Yes.
Sir, wouldn't you find this out doing the range of motion testing?
You would.
Why would you do this then if you're doing range of motion?
You may not need to, right? You may not need to, but if for some reason you're still hunting for something, right? You're hunting for something. You may do a straight leg raise, and you'd say, okay, straight leg raise only come to here. You should know, because you've already assessed range of motion, how far he can go, okay? Sometimes, though, these tests are used, right? Sometimes used in isolation. And I'm going to tell you, I'm going to be real frank. If you saw me practice, I don't use a whole lot of special tests. I put an awful lot of reliance on manual muscle testing and range of motion assessment and talking to the patient. But if you let me assess range of motion, you let me do a good assessment on strength, you let me assess the integrity of the joint with those techniques we talked about yesterday, I'll use 1 or 2 special tests on top of that. But you have to learn them to know which ones you're going to use. So you're not saying, and you look at those notes you guys got, was every special test listed? Not always. So that suggests that you're only going to use them when you need them. Okay, so special tests are going to be used to confirm, in many cases, what you already know. Does that back up what you were thinking? You're just confirming. Is it good to have 2 data points instead of just 1? It is, right? And you want to make sure. So I assess this here. I can't go any further. I already know he's limited in hip flexion, so I'm concerned about the hip in that case. Versus if I come all the way up here. Tight hamstrings, but I'm going to do my 90-90 test, right? I'm going to know about that as well. I may have done piriformis, so I'm going to know if his sciatic nerve's involved or not. Really good question. What's next? So that's sign of the buttock. What do we do before that? Scour. So do scour, be gentle, sign of the buttock. And the last three are for femoral stress fractures. All right, so once again, be very, very careful with these. So I listed them on the slide in terms of, the first one is this percussion test. Once again, real scientific. If there's some type of disruption in the cortical margin of a bone, you come here and you tap the heel. Percussion test. What's going to happen if he has a femoral neck stress fracture with this? This is going to hurt. That's going to hurt. Okay, so you would percuss first before you do anything else. And you're looking for pain where? His chief complaint of pain, right? If it's deep in the groin or along the femur, that's what you're looking for. The next one is the fulcrum test. Go ahead and sit up for me if you would. Feet facing the other. This needs a name too. Fulcrum test. If he has a fracture along here, if I put my hand here and fulcrum that fracture over top my arm, that should hurt. Positive fulcrum test. Right? It's a positive fulcrum. Be careful as you're leaning into that. And then finally, if you're really hunting for stuff, your book talks about doing hop tests to try and sort this out. Because a patient with a femoral neck stress fracture, if they start to load that one leg, right? And these are patients in the really early stages, right? And you're really trying to figure out what's going on. When I load that hip, well, I get really a deep, burning, pain-like sensation in my hip, right? And you got to be concerned about that. Someone who comes in and they have already a positive stress reaction on a bone scan, do we need to do hop testing? Do we need to do a fulcrum test? That's the gold standard diagnostic test. You can't get a better test than a bone scan to diagnose a stress fracture. All right? You guys good? So 3 tests. I can't remember. Scour, sign of the buttock. Heel, yeah. Tap the heel a little bit so you guys get a feel for that. You don't need to do it real hard. Just tap the heel, and then finally do the fulcrum test. And then we'll come back and we'll go through the palpation scheme, and that's it.